indoor air quality is a big issue. There is evidence that exposure to indoor air pollutants, especially for the children from their early life, from their birth and infancy to the preschool and school age, is associated with impacts on their respiratory system, with impacts on their cognitive performance in the school, can cause, in some cases, some effects also in their later life. We try and we are interested, and we, as a health organization, in the health of our children, because our children are more vulnerable than us. Their system, their organs are still developing, so they are more susceptible to the impacts of air quality, especially of the indoor air quality. And the other thing, if I can say that, is that perhaps they have also this lack of control. So, I mean that as adults, and especially working for the government, we can try to put any legislation in place. We try to influence the policies and practically reduce our exposure to air pollution. We can do all these nice things. But our poor children actually rely on us in order to protect them from protect their exposure and actually create a safe environment for them. So it is really a big task that we have in this place. We are here, first of all, as UKHSA, to present our work that we carried out, which was funded by Eurovent. It was a literature review on the assessment on the impact of indoor environmental quality on children's health, but also the absenteeism and their performance in the school environment, and if it's possible to provide some information on the quantification side. I had the chance also to present from my side the work that we carried out. We have actually been carrying out within our organization over the period of 7-8 years now on the impact of indoor environmental quality on children in the school environment. And if I can continue, we had really the chance to work quite a lot with other government departments. First of all, it is the Department for Education in England, and we had the chance for the very first time in the UK to introduce the WHO 2010 indoor air quality guidelines in the school environment, in the classrooms, and also the WHO 2009 guidelines on damp and mold, actually, and biological contamination, again in classrooms, together with the HSC, the Health and Safety Executive Guidelines, which are used actually for a workplace, but these are applied in environments where we have art activities or anything else like that. We have the chance also to work with other government departments for the revision of the building regulations. I'm talking actually the Part F on the ventilation side, and it is the second volume, which refers on actually other buildings than the residential environment. We have carried out our own work in this area regarding especially the outdoor environment and interventions that can be applied in relation to the outdoor air quality around schools. But at the same time, we're working quite closely with industry. I mean, we've got this funding now from Eurovent, but at the same time, we're working with SIBSI. We have contributed to various publications from SIBSI, and the latest one is the TM57, if I remember well the numbers, which refers actually to the design and integrated design for the school environment. And over there is a brand new chapter on indoor environmental quality. Yes, UKHSA is the UK Health Security Agency. We are an executive agency to the Department of Health, and we are here really in order to protect people from infectious diseases, from environmental radiation, and this kind of hazards that can affect our health. So we're here to save lives. It was Public Health England, and it was before that the Health Protection Agency. I mean, I joined the organization while it was Public Health England from the beginning, but now we are a UK Health Security Agency. Absolutely. With other organizations, with government departments, because we're trying actually through our work both to review but also to develop the evidence in order to provide the evidence that the government departments are needed for their policies in the area of the indoor air or the outdoor air. So, but also with, as you said, with other organizations. We're working quite closely with industry. SIBSI is there, and we're trying to help them.